yoga in the morning, and now we're doing brunch, and then we're gonna go study at the library. We are leaving the urgent care center. Today I got to reduce a shoulder, which is freaking awesome because I felt the clunk as I like popped the shoulder back in. It was very, very satisfying. We did it only with laughing gas, so Can I get the apple? Julia, you want cake? Ta-da! You did it! You got cake! See, there's two. Oh, 2 chocolate, 2 matcha. Amazing. Oh, which way's up? I think this way's up. No, the other way's up. The other way's up. Yeah, that's all. Look at us and our hot pot. Do you have scissors?
Yeah. Hot pot times 2.
Pot 2.
Hot. Wait.
Happy birthday to you. Happy birthday to Paul. Happy birthday to you. Best day. Actually, it does work. It does go well, Russell.
What?
With Julia at a cafe. The hospital now. Was on call last night for internal medicine. As you last night was super exciting. I found it super interesting, learned so much from my senior, from our staff, from the patients and families, of course. It's always a privilege to be involved in everyone's care. I pronounced a death yesterday, not my first time, so that was pretty routine, but there was one case I got called for a code, and it took over, I think, 4 hours total between me and my senior together. I was really proud of myself. My staff gave me a compliment for just being so calm in handling the code despite there being a massive hemorrhage. I guess now that I'm in R2, I think I've seen enough threatening situations and been involved in codes that I now realize the most important thing that I can do for patients is to come and arrive, be calm, because that's what the whole team needs, is for someone to come in and calm and be collected and stay collected when talking to the rest of the team and to the family. So that's something I really strove to do. Back from Halloween party with my family medicine co-residents. It was lots of fun. One of the things we did first was we had a Halloween pumpkin carving contest, and me and Ange made one that was an owl, and I just was like, apparently everyone was like, I was super focused, was very into it. I had a lot of fun, and our pumpkin won the contest, won the votes by a landslide. And yeah, it was like nice to like talk to people, catch up with people, and there's definitely like like a whole bunch of different co-residents that I still want to continue to get even closer with. Yeah.
I vote into this bowl.
Okay,
Right
explain
here.
the rules. Explain the rules.
The rule is you gotta push it.
Action!
Dirty, whereas bitch she died in the process.
Doesn't it look more like a giant tree without feet? I was actually thinking this before I put it on.
You straddle it. Yeah, here's here. Yeah, just like that. Great.
In the morning. I've just come home from the hospital after being on call last night, and despite being a doctor, I am enjoying a tiramisu cake. My friend in Vancouver ordered it for me as a reward for being on call, so thank you. And it's actually really good. It's from a place in Calgary called La Dippery, and then my friend also sent us popsicles, and so we had the chocolate one, which tastes a little bit more coffee, and I'm excited to try the matcha one. And I walked with a really nice senior last night. I felt like I learned a lot. I saw 3 different patients, so we stayed up pretty late. I think I went to bed around 3:30 in the morning, and there were some pages to deal with like in between 3:30 and in the morning, so some different cases. I felt like something that had improved. My staff had commented in the morning when I presented the case that the way I'm presenting my cases in the morning has gotten more organized, easy to follow, and some feedback I also got from my previous week was working on slowing down while I'm talking. I tend to talk really quickly, and so I'm trying to work on slowing down, pausing, giving people time to absorb what I'm saying, and that way be concise and slow and clear and easy to follow. So things I'm working on. I think I'm getting a lot faster doing my consults at night, but actually what I want to work on is not necessarily speed, but I want to work more on creating my issues and plans. So thinking through, this is the issue, what do I think is going on, what am I going to order for testing, and what am I going to do for the plan. That's something that I'm still working on. One thing I really like about internal medicine is that we work with a senior, so someone who is a year above or 2 years above, and I found that a really supportive environment. They're right there with doing the call with you, If it's really heavy, they'll do some consults on their own, but I just felt like it's a very supportive environment. I know that I'll be able to run something through someone, and I don't feel stupid asking questions. I try to do everything independently, of course, but it just feels really, really nice to have this like safety net and know that someone's just right there, got your back. I do like that culture of internal medicine, at least here in Calgary. Something that I find a little bit difficult about internal medicine is that every week we have a different staff attending, whereas compared to some different services where you might have the same preceptor for a while, so each person has a different style, so sometimes that's a bit hard to get used to. So this is my last weekend on call for this internal medicine rotation, which is nice because I've done 2 weekends in a row. I'll be on call again tomorrow and then again on Thursday, so I need to get some rest and recuperation. What else? So far, the acuity in internal medicine is quite fun. Patients that are, you think you just read about, but they're actually quite sick. Their blood pressures are hypotensive and you have to slam them with lots of fluids, and or they're bleeding out really quickly. It makes it quite interesting and quite fun. So I'm just going to enjoy my tiramisu cake. I'm trying to think what else is interesting to talk about. It's like really interesting to work with medical students. University of Calgary is a 3-year program, but so we're working with their clerkship students. And it's like really interesting. Really it wasn't that long ago that I was in medical school. It also feels really far away at the same time. For example, our medical student that I was on call with last night was studying for an exam that's coming up, so that not only when you're in medical, not only are you working and doing a full rotation, but you're also studying on the side. We do that as a resident as well, but it's a little bit different. At least in my residency, we don't have testing every block the way that we did when I was in medical school. So for example, like in medical school, you do pediatrics and obstetrics, and then you have an exam right after that, and then you do all your surgery rotations, and you have a surgery rotation. We have a big exam at the end of residency, and so we study along the way for that, but I guess it's less of a time pressure to always have mini exams. So I actually feel like in some ways I personally find residency a lot less stressful than medical school. I feel like medical school was a lot more stressful in my opinion, but that's just my opinion. So I personally think if you're in medical school and it sucks and it's rough, medical school is a lot better than undergrad. Residency is a lot better than medical school. It just gets better along the way. I know a lot of people will tell you it just gets worse as it goes along. I really genuinely think it gets better the further you go along. So keep at it. It gets better. I promise it really gets better. And I guess I look forward to getting even better as I go along. This tiramisu from La Debris is actually really good. Something that I talked to my senior about yesterday was I, for example, don't feel smart enough to do internal medicine at times, especially on call when I'm not, I'm like struggling to put together a plan on how to manage an expanding hematoma, or how to manage something that's super undifferentiated septic shock. And he was telling me that he doesn't feel smart enough for internal medicine. He feels like there's so many other residents at the same level that are so much smarter and better at him than internal medicine. But he's like, I do. Instead, he's like, I think of it this way. He's like, keep some self-compassion for yourself, and you just, sometimes you can do a good enough job. You can keep people alive and it works enough. You might not be the smartest, but you're capable enough of doing enough of a job to keep them alive and keep them along and keep trekking along in residency. So I think as a perfectionist, I always want to be the best and do a perfect job of everything all the time, so that does help as a reminder to reframe that you don't always have to do like the bestest job or the most flawless job ever, but sometimes it's just about doing a good enough job. That's how it feels like in residency. Sometimes it's just doing a good enough job to keep people alive through the night, as opposed to doing a flawless job. And yeah, it's something I want to remind myself in. And what else? And then yeah, the comparison thing I was saying, sometimes what I find really hard is, you know, I'm a second year family medicine resident, and my seniors can be an R2 internal medicine resident. And so I said, you know, I feel very stupid and inferior compared to the R2 internists and internal residents, and I just feel like I should be better if I'm, you know, at the same level of training. And my senior reminded me that it's just a different skill set and knowledge. He's like, that reminds me that I know things that the internal residents don't. I've done different rotations and a lot more capable in clinic and outside of things. So it's not that I'm stupid, which is the instant thing that I jump to, but it's just carrying a different set of skills and knowledge, and now I'm just kind of changing that and learning along. And they do a lot more MT than I've done, but I guess I just want to be at that level. I want to have that level of knowledge and ability to deal with acuity and have that comfort level of dealing some of these conditions. I find that really annoying about family, is I don't feel like I see enough of anything, enough to be an expert in anything, which is hard. I just want to be like good and better at something in particular. Yeah,